Welcome to SIWI Corner, and today we're going to be looking at one of the most discussed topics here at World Water Week, the global pandemic. Joining me, I have Henning, Göransson, Sandberg and Panchali, Saikia from SIWI's Water and Sanitation team. You've both been living through this past tumultuous year along with the rest of us, where everything has changed profoundly. Can you describe a little bit from your perspectives how you've experienced the past year?
Yeah, so in Sweden, where I've been, the effect has, of course, been very, very severe. So, like in many other countries, it's turned epidemiologists into national celebrities, and it's really underlined the vital work that healthcare professionals do to keep us all healthy and safe. In the beginning of the pandemic, we had a lot of cases, we had a lot of deaths, especially in elderly care homes. But overall, the effect in Sweden and the restrictions that we've had have been relatively mild, especially compared to some other countries, such as India, that Panchali has more knowledge about.
Yes, talking about India, the first image that appears in my mind is the heartbreaking scenes of the nationwide lockdown that sparked mass migration, pushing labour migrants to extreme despair, hunger and homelessness. The pandemic has hit quite hard in the second wave early this year, having a devastating impact on the country's health system. The vaccination drive seems to be going good so far, with some incredible efforts and initiatives. But the road ahead is quite tough, with the risk of the virus spreading across rural areas.
Thank you for sharing, and it has been truly devastating to hear about the loss of lives and livelihoods around the world. How has the Covid-19 pandemic impacted your field of work?
It's impacted our work quite considerably, I would say. So many of the projects and programs that we've been working on have been reprioritized and refocused on the effect of the pandemic on water and sanitation services globally. And generally what COVID-19 has done is to really make visible and exacerbate existing inequalities along the lines of income, gender, location, disability, and so on. And these were factors that were already determining access to wash even before the pandemic. The pandemic has also underlined a chronic underinvestment in basic public health measures, such as water and sanitation. And it's also underlined a long-standing failure to uphold the basic human right to water and sanitation.
And we've even seen shortcomings as well in the vaccine distribution. Yeah,
the global vaccine distribution is just the latest moral failing of the higher income nations to the lower income nations. The world really must realize and take into account the leave no one behind principle of the Sustainable Development Goals. And this is to take the status of those most vulnerable into account when rebuilding for the future.
Exactly. And how about you, Panchali?
Our work involves a lot of traveling to conduct trainings and also provide support to countries on water and sanitation governance. With the travel restrictions, we had to adapt this and also conduct online workshops and trainings. This kind of technical support to countries has become really important in the current scenario, with the pandemic highlighting on the water and sanitation gaps and the increasing priority and need to improve the access to safe and continued and resilient services.
Exactly, and you both have quite unique insights into what's happened to water and sanitation since the global pandemic began, as you've been working on a mapping project along with UNICEF. What did you find?
Yeah, so since the beginning of the outbreak, we at SIWI have worked together with UNICEF to map some of the initiatives implemented in response to the COVID-19 pandemic. So we looked at 84 countries in total, and we categorized initiatives into those that sought to expand services to water and sanitation, and also those that sought to improve hand hygiene and stop the spread of the disease, as well as some initiatives that sought to bring financial support and technical support to utilities that are the ones that are providing these services to people.
Yes, the mapping showed differences across regions and countries, but there were also some common trends. Hygiene promotion, like Henning had said, and other measures to control infections have been widely adopted, although not matched in terms of the ambition of assuring availability of soap, water, and hand washing facilities.
That is a shame to hear. What have we been seeing on a more local level?
At a lack of support to the most vulnerable population, more needs to be done in terms of improving the water and sanitation services, especially in small towns and rural areas, and also in terms of the urban slums, the services in urban slums where they are sharing the toilets facilities. And not to forget, in healthcare facilities and also schools, now that societies are opening up.
Of course. And Latin America is one of the regions that we conducted this mapping in. We're now going to hear from our colleague Lourdes Álvarez, who's based at our office in Bogota, Colombia.
In Latin America and the Caribbean, countries and communities were hit hard by COVID-19 with over 1 million COVID-related deaths. This immense challenge led to previously unseen short-term measures to ensure access to water for even the poorest members of society. There has been also a huge step forward in behavior, the importance of hand washing from a health perspective being much more widely accepted. Many water and sanitation utilities have advanced years in terms of how to work remotely, improved supply chains, established online payment systems, customer complaints mechanisms, and more. The lessons learned during the COVID-19 pandemic and the work that SIWI has done can continue to save lives for decades if sectors commit to continuing to realize the human rights to sanitation and water, and has helped us realize that nothing is impossible when the impetus is great enough.
Lourdes highlighted on a very important point there, ensuring the continuation of these services and also building resilience of water utilities and service providers. Towards this, financial viability and sustainability will be very vital. And in terms of, given that now water utilities are operating at a loss, but also important is in terms of balancing how the utilities and service providers are going to recover this loss, and also ensuring and responding to the affordability of all users, including the poor.
Of course.
Yeah. And ironically, some of the measures that have been implemented providing free water to people may, in the long run, actually have negative impacts on the availability of water. It might mean that this loss in revenue that utilities have seen and that service providers have seen may mean that fewer investments are done in water and sanitation in the future.
And what would be the long-term effects of that?
Well, it means that expansion of services cannot be maintained. And this is what we've seen during the pandemic, expansion of services, which has been really, really great. But with this loss of revenue, it's the case that new projects, new upgrades cannot be done. They might be completely cancelled or postponed. So it's important to realize the danger of this now and to invest in order to keep the services maintained, keep the expanded reach of the services that we've seen during the pandemic.
It really is. And thank you, Henning, for joining us today and sharing your insights and knowledge on this. Soon we will be joined by our colleague Jennifer. But first, when we're talking about the pandemic, we also need to talk about the social and economic hardships that have been experienced. In Africa alone, close to 40 million people could fall into poverty this year. Now we're going to hear from Xanani Baloyi, who's based in our office in Pretoria, South Africa.
In South Africa, the COVID situation has seen rising deaths and infections. But at the same time, we have seen an increasing or threat to food security, where people that were working in the cities and urban areas and tourism sectors have had to return back to their home villages or countryside to secure a livelihood for themselves. And this has shown us that the agricultural sector is actually the backbone of this economy. While many sectors were hit hard, the agricultural sector remained to function and employ some people. About 95% of the agricultural produce from sub-Saharan Africa is from rainwater. This has also shown us the importance of investing in water management, in soil management, involving the farmers, so that when the COVID situation and also climate change hit, there is still some productivity taking place for the agricultural sector in Africa.
Panchali and I are now joined by Jennifer Junn from SIWI's international policy team. Jennifer and Panchali, what can we learn from what Xanani's just shared?
Let me take that point that Xanani talked about in terms of the reverse migration from urban to rural that was triggered by the pandemic. It is very important to understand this migration trends and how it impacts on the water use and management in urban areas, in peri-urban areas, small towns and rural areas. I strongly feel that it is so crucial to enhance this rural-urban partnership in terms of jointly managing and conserving the depleting resources, coherence across policies around water, land, ecosystem degradations, and special planning.
Yeah, I think many of the trends that we're seeing today, they help us to rethink many policies, especially policies related to food systems, how we relate to food. And I would say, especially in the case of the importing of foods, we should look at the trends and we should look at the developments and see that there are opportunities to invest in practices, invest in initiatives that will increase the resilience of farmers. And one of those initiatives, one of those ideas is rain-fed agriculture. When climate change makes rainfall patterns more unpredictable, and sometimes it leads to water scarcity, we really need these kinds of solutions to strengthen the ability of farmers to cope with these changes.
And are we seeing a greater interest in these sorts of solutions on a global platform scale?
Absolutely. There is a heightened interest in global solutions, but also in looking at some foundational, fundamental challenges that we have. I would say that it's important to look at vulnerabilities. It's important to look at risks. It's important to look at, as I mentioned, food systems, energy systems, the global value chain, and in general, our consumption norms and habits. We do need big changes. But as we can see in today's COVID times, we know that there's a lack of solidarity among countries. There is a lack of the mobilization of aid that should go to supporting the more vulnerable countries and communities in the world. So that is a big problem, that is a big challenge to cope with.
I agree. I mean, this growing gaps is quite worrying. And in many places, we saw this increasing and growing inequalities in the wake of COVID-19, which have had disproportionate impact on the unskilled laborers and marginalized groups.
And if we don't act now, I think many of the consequences of these, what's happening today will be long lasting. So we really have to make sure that the recovery efforts that we focus on today, they are actively helping to close these gaps.
Exactly. And thank you both for joining me and putting into context the short and long-term impact of COVID-19. I've heard both despair and hope in what we have discussed today. And the perspectives from our international colleagues highlight the opportunities there are around the world to build back better. To do so, we must make sure solutions are sustainable, both financially and in terms of resilience, and that no one is left behind. Thank you for joining us for today's SIWI Corner. And if you'd like to watch the next one, we'll be talking about what goes on behind the scenes in the preparations before big climate meetings like COP26.